Hi everyone, I'm Haley Johnson. Today I'm going to be discussing a whole food plant-based diet. We will discuss what the diet is, what some positives and negatives could be, what training and referrals there are, and ideas to consider as a nurse. First, I'll ask you, the viewers, to think about something for a moment. Pause this video if you must, but I just want to ask you, what do you think of when you hear the phrase whole food plant-based diet? Now, maybe some of you thought vegan or vegetarian, a color maybe even came to mind. Maybe you even thought boring. Well, I would agree that these photos look far from appealing. You might have heard the saying, you are what you eat. Today, the amount of research on the foods we are eating is increasing. People are becoming more and more familiar about the kinds of foods we should put in our body. However, the kind of diet I will be discussing with you today is far from new, and it is quite simple. It can be as colorful, fun, and as tasty as you'd like. You can play up salads with a ton of flavor. You can still create food that makes your tummy feel warm, like soups and curries, and you can still be very creative and have the same foods you love, just with some alternatives. For example, the tacos use cauliflower as a substitute for taco meat. There are many cookbooks out there dedicated to whole food plant-based recipes. You still may be wondering what exactly the diet is. Well, let's get into that. A whole food plant-based diet focuses on emphasizing whole, unrefined, or minimally processed foods. The diet does not require you to count calories or completely cut out foods. The diet focuses on the wholeness and foundation of one's diet. The whole food plant-based diet promotes lifestyle, not restrictions. The foods in the diet consist of whole foods such as fruits, vegetables, nuts, seeds, legumes, lentils, beans, and much more. Although it sounds like a vegan or vegetarian diet, it is a bit different in the sense that you are still allowed to incorporate some animal product if you'd like. However, some may still choose to eliminate it completely. But does this mean you should have steak every other night? No, probably not. Perhaps 2 or 3 times a month. That's the nice thing about this way of eating. It can work without being restrictive. Now, let's discuss some positives of the whole food plant-based diet. Much of the whole food plant-based diet's qualities were brought to the media's attention through a documentary called Forks Over Knives, claiming that the diet possesses abilities in preventing, halting, or even reversing certain health conditions. After doing some research, I found some great insight as to the positives of converting to this style of eating. A case report on an 82-year-old patient prescribed 12 weeks of an exclusively whole food and plant-based diet resulted in the physician reducing and even discontinuing medications for the patient. The patient's cholesterol dropped. He reported feeling much better and that he could think clearly after discontinuing a medication prescribed for his congestive heart failure. One study with over 2,000 patients aged 60 to 80 years old with history of heart attacks showed less depressive symptoms and higher optimism with an exclusively whole foods diet. In an interview about the World Health Organization's findings on processed meat's carcinogenic components, Kana Wu explains how high consumption of red or processed meat can increase the risk of chronic diseases and mortality. Therefore, this diet seems a bit more appealing. However, we will take everything with a grain of salt. One article from Complementary Therapies in Medicine shows an overall improvement in the quality of life and chronic pain. Something else that some may find as a positive is that there are larger portions. In many situations, people find hesitancy in grabbing large quantities of food. While this is to be expected with highly refined foods, whole foods and plants contain fewer calories, which means you ought to eat even more. So, grab a bigger plate or go up for seconds. So now that we've discussed a great deal of positives that can come from a whole food plant-based diet, let's discuss some possible challenges. Because not everyone follows the same definitions of a whole foods or plant-based diet, there can obviously be some discrepancies. Next, people can miss out on key nutrients such as protein with animal product. Some people may even be concerned about certain B vitamins, so they start supplementing without any medical or nutritional advice from health professionals. People can find themselves only consuming vegetables or only fruits, and that's when people begin to lack essential fats and carbohydrates that are vital for brain function and energy. Without proper guidance, people can find themselves going into a calorie deficit and not even know it. This can be highly problematic for people that should be in a calorie surplus, like some athletes. Something that I myself have even found challenging is that preparing food is just more time consuming. Preparing whole food plant-based recipes just takes longer, so making the time to meal prep for the week or even a couple days might be necessary. This could be difficult for those who experience difficulties with activities of daily living. Now, let's discuss what kind of training and referrals are necessary. Normally, only a registered dietitian or a licensed physician can prescribe or order meal plans. There are some schools who provide training and certificates in whole food plant-based diets, but they are not all created equally. So this is something to be cautious of. And you should always seek a health professional's advice and training when considering these changes. Now, let's discuss some of the nursing considerations. Things we as future nurses should consider about the whole food plant-based diet is that we should take interest and gain knowledge on different styles of eating. This will help us better understand a variety of patients and their situations. Anyone who tries the diet should have discussed the idea with either a physician or registered dietitian. They should have had some educational training and they should have had done some research. As nurses, we need to be promoting our patients' health and educating them while still having a holistic approach. How is their diet affecting them? Asking them questions and prompting their interest in their overall health can help them implement healthy changes. As much as the diet seems to work wonders, we need to be looking out for the patient's safety and well-being. Different things will work differently for everyone. We can't promise anything as nurses. We can be there through the changes, the highs and lows, and help advocate for our patients' health. So now, I ask you, what do you think of when you hear the phrase whole food plant-based diet? Does anything new come to mind? Hopefully you've learned something today about this style of eating and how it could possibly help your patients or maybe even yourself one day. Thank you for listening.